So I wanted to do a quick video as a checkup for my dental implants and show you guys how they're doing, and they're good. But I also wanted to answer some questions that I'm sure you guys have about dental implants. And a while back I got an email from this nice lady where she asked like a whole list of questions, and I thought this would be great to answer in a video. So here is a dental implant FAQ. Do your jaws or bones ache? They did for a couple weeks after the surgery, but that was only when I didn't take my pain meds, and I haven't had trouble since then. Do you feel pressure on the implants? Only when I try to eat really hard things. My doctor gave me the rule, only eat things if you can cut them with a fork, which I really love Slim Jims, so I've been eating Slim Jims with them. I think I did eat one like the day after surgery, which was kind of stretching it because you can technically cut that with a fork, but you kind of have to saw it. But do I feel pressure on the implants? Usually no, just only if I like bite into hard candy, which don't do that. Is drool a problem? Somewhat. I did drool a bit more in the weeks following the surgery, which is normal because dental implants are a foreign object in your mouth and your body isn't really sure what to do with them yet. But drool isn't going to be like a huge problem. You're not going to have a big gob fall out when you're talking to someone like, "Oh yes, Karen, I think that I'll bring hash browns to the pot." Excuse me. Do you have a hard time talking with dental implants? Somewhat. Again, it's a foreign object in your mouth, so you gotta get used to it all over again, and you just have to kind of learn the new phonetics with a new object in your mouth, which I had with dentures too. I had a really bad lisp when I first got dentures, and so it helps to like practice in the mirror so you can like see the way your mouth moves and just go A, B, C, D, E, F, G, lisp, 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 lisp. But it'll get better, it's not a forever thing. Are the screws or implants visible at all? Well, not when you're talking, not unless you like to talk like this. And even then, I'm not sure if you could actually see them or not, because like, I'll show you. There is a very slight gap between your real gums and your new teeth. So yeah, you want to have at least a small gap between your gums and your teeth because you want to be able to clean between there. It's not just like impacted like you're never gonna touch your gums again. There will be a small gap. Do you get food stuck under them? Yeah, but not as bad as with dentures, because with the dentures, then they would just kind of grind on top of the food, on top of the gums, and I would get blisters. With these, they just kind of, they're chilling under the teeth. I usually just swish water around my mouth after eating, or even while I'm eating to get the food out, and that usually does it. If you have stuff that's like really in there, you can use this thing called a water pick that'll like really clean it out, but I wouldn't suggest using that right after surgery. Like I still haven't used one yet because a water pick might just shoot the food or bacteria in it deeper into your tender gums and give you an infection and nasty. Do you suck on your teeth unconsciously? Well, yeah, it's kind of like with braces, there's just something new in your mouth. So for like the first month after I got the implants, every day I was just like, "Nyeh, nyeh, nyeh." Yeah, it's just part of getting used to something new in your mouth. And last question, can you eat completely normally? And the answer to that is mostly. Like with the whole don't eat anything that you can't cut with a fork thing, you can't cut steak with a fork. But like, that doesn't affect the way I usually eat. I don't usually eat steak every day. And this is only with the healing process, like the 6 months until you get your permanence. When I get my permanence, then I can eat all the steak I want. But right now, I can't eat anything that's like really tough or really hard. So I'll tell you this, I can definitely eat better than I did with dentures. With dentures, the impact of the bite would go onto my gums, and the teeth weren't aligned properly, so I couldn't actually bite down. So now I can actually eat better than I did before because my teeth actually all touch and the impact of the bite goes to the implants and not to my gums. So now it doesn't hurt whenever I chew. And yeah, it's actually a lot more comfortable now, so I actually eat better. So yeah, those are all the questions that I think could sum up this FAQ. If you have any more, leave them in the comments below and we'll see if we can get some more answered. But keep in mind, I'm not a doctor. This has just been my experience with dental implants, so if you have any other questions like adjustments or something going wrong with a dental implant or just anything that's bothering you about them, if you have them currently, then I would ask your doctor. So yeah, great questions. If you have any more, leave them in the comments below. And thank you so much for tuning in to my awkward little life. And I guess whenever I post next, then I will see you. Much love.